It's the Superhuman Television Show, your guide to living beyond 100 years in good health. Now, here's your host, Carl Lanore and Tony Vanetti.
Good afternoon, everybody, and welcome to Superhuman Television. My name is Tony Vanetti. You may know me from local television radio for the last 22 years. I've been doing different things from rock DJ to, I do a sports show that happens again later this afternoon at 3 o'clock. But again, from newspaper, The Voice newspaper, all over town. So I've been here a long time. I started my journey 6 years ago into health and fitness, and we brought it to this show today basically because I met this guy, Carl Lanore, which is basically has this show on the radio in pretty much every state in the union.
Well, yeah, Superhuman Radio has been around for about almost 9 years now. And the show is dedicated to health, fitness, and longevity. We reach every state in the United States. It's internationally syndicated. We have a large following in Australia, the UK, Canada, and so on. And the mission of the show is to change lives, just like this TV show is going to do.
Right. We want you to live longer, to feel better, look better. Everybody want to look better? Do you want to look better?
Yes.
Anybody back in the home, do you not want to look better or feel better, then don't watch the show.
Yeah, turn the TV off now.
And by the way, this a little bit later Carl will answer whether this is a good snack or not a little bit later in the show. Carl, today's topic
is reversing type 2 diabetes. A lot of people have type 2 diabetes today. And we're not going to be covering the traditional pharmaceutical drugs like metformin and glucophage or any of those kind of things.
Okay.
We're going to be talking about how you develop type 2 diabetes and a different way to think about it that will actually allow you to cure yourself of type 2 diabetes, even if you're on insulin already.
Okay, and we live in the state of Kentucky, which I would say, haven't seen any numbers, but I would probably guess that there's a high rate of diabetes in the state of Kentucky.
Well, in fact, I think we have a graphic here. The World Health Organization estimates that 350 million people around the world have type 2 diabetes. In the United States alone, 25.8 million children. That's insane. And approximately 2 million new cases diagnosed inside the United States every year.
That's just 26 million people eating, or kids eating the wrong food.
And you just said something that's important to acknowledge. Type 2 diabetes is exclusively a result of diet and can be cured by diet.
This isn't like leukemia or any other disease. You get diseases because you get type 2 diabetes.
I wouldn't call it a disease.
Okay.
I would call it a condition.
Okay.
Because it's completely reversible. 99% of the people who have type 2 diabetes, they can reverse it. Now, right now, you're probably out there saying to yourself, well, how can that be, Carl? My doctor has never said I can cure myself of this disease. He just keeps writing me prescriptions, and that's exactly true. But your doctor doesn't understand how to reverse the disease. And you're saying, well, how can that be, Carl? My doctor is smart. He went to school. Your doctor went to school to prescribe prescription drugs.
So if you're watching this right now, watch it for your kids if you have children or yourself. But this is important because I've been to the Juvenile Diabetes Center, and I'm telling you, when you see the bandolier of needles that a 9-year-old girl has to inject herself over a month period of time, okay? I met this young lady, and and it went to the floor and out towards the chairs, and I have to inject this in every single day. You don't want to get there.
Well, how do people get type 2 diabetes, you think? Oh, wait a minute, this is even better. When people get diabetes, these are the diseases that kill them. See, no one dies of diabetes. They die of the damage to the heart. They die of the high blood pressure, which causes stroke. They die of the dyslipidemia, which is cholesterol issues, blindness, cancer, neuropathic degeneration, which is destruction of the nervous system, including the brain, kidney failure, vascular disease. And now they're even implicating Alzheimer's disease and depression with type 2 diabetes.
This is just managing sugar?
Yes, it is. And we're going to tell people how to do that. But before we get there, we have to talk about, this is a great picture here. Tony, do you own a glucometer?
No, why would I own that?
Because you don't have diabetes, right?
No, right.
I own a glucometer and I don't have diabetes.
Why? You're not a chubby guy.
Because if you manage your blood sugar, you will live longer.
Okay.
And so just the way I check the oil in my car, and I don't want to drive my car past when the oil's viscosity drops and I'm damaging my engine, I don't want to have high blood sugar levels.
Okay.
I want to manage and I don't ever want to have to go to the doctor and become a patient for diabetes drugs. So you start now because people usually don't see any symptoms for maybe even a decade before they become full-blown diabetic.
Okay, so here we are, diabetes. And again, I've always thought, in this society that the basic needs for society before you pave any roads is to be able to take care of your children. And that's why we're going to talk about diabetes today.
Well, let's talk about
watch out what you feed. Now, I will tell you this. There are things that I would not eat that my children eat. I'm terrible at this. I'm part of the problem.
This is important, okay? Everybody's looking at the cost of shaving the budget today in the United States. This is the direct and indirect cost of diabetes in this country. $245 billion a year just on the diagnosed cases of diabetes in 2012. Another $176 billion for direct medical costs and $69 billion in reduced productivity. Almost $500 billion a year type 2 diabetes is costing this country today.
Unbelievable facts. Again, we're gonna break this down, and then how can you reverse it? That's what we're going to talk about next, right here on Superhuman Television. My name is Tony Vanetti. He is Carl Lanore. And again, don't forget, we're going to answer whether this is a good snack food or not in the next segment. Stick around.
Superhuman Television will return after these messages.
Your body knows what it wants. It wants to feel stronger, work harder, act faster, and think sharper. Give your body more nutrients, more antioxidants, more protection, more of what it wants. Try Live On Lab's liposomal vitamin C today, risk-free, and give your body the nutrients to support your overall health, without jitters, without side effects. Order online at liveonlabs.com.
Welcome back. Thank you for joining us here on Superhuman Television. Again, I am Tony Vanetti.
And I'm Carl Lanore.
That's exactly right. And before we move on, we are talking about type 2 diabetes. What is the difference between type 1 and type 2?
Well, type 2 diabetes is acquired diabetes. It's a lifestyle that causes insulin resistance and failure of the pancreas. Type 1 diabetes is idiopathic failure of the pancreas. The islet cells of the pancreas, for some reason, just can't produce insulin at all.
Okay.
It usually happens very young. The onset of it, it's identified at a very, very young age. And those individuals can't reverse it because the pancreas just doesn't work at all.
Right. Okay, but we were talking about type 2. We wanted to get that on the table first, which is the preventable one, and that's what we talk about on this show is lifestyles and changing lifestyles to feel better, look better, and live longer is basically what Superhuman Television is all about.
But here's where the magic of curing or reversing your type 2 diabetes comes from.
Okay.
I want to position this in a different light than it's ever been positioned to you before. I happen to know that you have a daughter who is lactose intolerant.
Yes, that's accurate.
So, do you give her milk?
No.
Okay. Because she just can't.
No, she can't handle it.
She gets stomach distress.
There's stomach problems you can't really say on television here.
Right, okay. So here's what I want you to think about. People who develop type 2 diabetes become carbohydrate intolerant.
Okay.
Now, I'm not talking about green leafy vegetables.
Right.
I'm not talking about broccoli and spinach. I'm not talking about kale. I'm not I'm talking about pasta, bread, rice, rice cakes, fruit. Even though the American Diabetic Association will tell diabetics that they can eat fruit, they should not eat fruit. It's a sugar.
Right, okay. Yeah.
Sugars have to stay away from them. So people go to me, but Carl, that's impossible. How can I eliminate those things from your diet? It's very, very easy.
Right.
If you switch to healthy animal proteins, healthy fats, green leafy vegetables as the primary basis of your meals, within a few days, you'll see your blood sugar come down.
Come down.
Come
right.
down.
Right, because basically strawberries and bananas, I mean, that's why I brought the banana today. We've always talked about whether this is a good snack or not. Strawberries are just sugar, nature's sugar.
But actually, berries tend to have the least amount of sugar, the most amount of fiber.
Okay.
And so, but in the initial stages, if you are type 2 diabetic, you're taking metformin, you're taking glucophage, you're taking a pharmaceutical drug to correct it, then for the first 6 months, you have to be very hardcore about your diet.
Okay.
Because you have to be strong about your diet because you want to reverse it. So you have to eliminate all these things, the breads, the grains, the pastas, the ice cream, the milk, everything. Everything that has sugar or starch in it.
Can I inherit some sort of, can I walk down the diabetes, type 2 diabetes path easier because of who my parents are?
Possibly. There may be a genetic component to your sensitivity to carbohydrates.
Okay.
but that doesn't mean that you must carry the disorder.
Okay.
Okay? Because as a wise person, Elisa Profumo likes to say, your genetics are like the gun, and your lifestyle is the finger on the trigger.
You should consult your doctor if you think your kids could be walking down that path. If you jump it early and change what their eating habits are, if they don't ever know about it, then what's going to hurt them? You need about food I'm talking about. So consult a doctor, find out if your kids, if they're on that end of that thing, because you don't want to get to where you're diagnosed with type 2 diabetes, because that is preventable, and they're going to blame you. I mean, they're going to blame the parents for what they feed their kids, and I'm as guilty as anyone. I don't want to get out there and accuse anybody, because there are things that I feed my children I would never eat. And
yes.
in the matter of convenience, I feed my
yes.
children food that I would never consume myself, which is awful, and I need to fix that. That's for sure.
The other thing that we have to think about is some work that was done at the State University of New York by Dr. Paul Osiero, where he discovered that there's a major insulin spike once the 30 grams of carbohydrate threshold is reached. So if you are eating carbohydrates,
for the day or the meal?
For the meal, for the sitting.
Okay, all right.
So if you sit down at a meal and you have a bunch of, let's say, sweet potatoes, if you try to keep that at 30 grams or below, it's going to require less insulin.
Okay, I don't know if you're keeping count, but both of you and I are Italian. You're talking about bread and pasta.
I've had to give up pasta. I don't eat pasta.
Oh, my Lord.
I don't eat pasta anymore.
You don't eat pasta?
And I don't miss it.
How can you not miss pasta?
I don't miss it. I don't miss it. It's not. You know what? When I used to eat a big bowl of pasta, I used to get sleepy and tired.
Yeah. Oh,
and that was because of the insulinogenic response.
Right. Okay.
Everybody knows what that is.
Right.
So, but the bottom line is, if you look at a more ancestral diet, a Paleolithic style diet, animal proteins, green leafy vegetables, no legumes, no dairy, no grains whatsoever, no starches, for the first 6 months, you will watch your blood sugar come down.
Right.
And now you have to work with your doctor. If you're on glucophage, if you're on metformin, if you're on a insulin mimetic type drug, you have to tell your doctor you're going to do this, because he's going to have to adjust your dose down.
Right, yes.
But think about that.
Yes. These are clues to some alternatives to type 2 diabetes and be able to prevent this. Because, again, we're going to work with your lifestyle and what you eat to prevent these things if you're going to go down that path. Real quick, the banana.
The banana is loaded with sugar. For the first 6 months, you got to stay away from it.
But people, I thought this was like a diet food. Hey, have a banana for a snack.
No. You have to stay away from sugars. The other thing that you have to do is you have to start moving more. Even if you are unable to get up and walk around for a half hour, then just getting up is more activity. But you must increase your activity as well, especially in the daytime. And the third thing that you have to do to reverse your type 2 diabetes is go back to the show we did before this one and listen to it, because you have to get your sleep in line. People who don't sleep well become insulin resistant overnight.
That's exactly right.
Overnight.
Now, and how heavy? I mean, you're saying I should buy one of those to measure my blood sugar, and even know that I'm
not diabetic.
Obviously not diabetic, and I'm pretty good shape. So, I mean, at what point should you keep? Is there triggers? Are there symptoms?
I even test certain meals. I'll take a look at a meal. I'll eat a meal, and then it's called postprandial blood sugar. I'll eat a meal, and then I'll look at it 45 minutes after, just to see where my blood sugar went.
Okay.
But you don't have to be that fanatical about it. Just start checking your morning blood sugar levels. Have your doctor check your hemoglobin A1C. That's a 3-month snapshot of where your blood sugar is.
Remember, we're talking about type 2 diabetes. Consult your doctor on all the things we just talked about and be able to adjust your diet. I mean, that's as simple as what we're talking about in your lifestyle. And a lot of times that's what you'll end up hearing on this show is adjusting your diet and your physical activity are going to help you live longer, feel better as we move through this journey that we're on.
When we come back, we're going to talk about some supplements and some other things that you can use to help ensure your success in reversing your type 2 diabetes.
All right, back after this, Tony Vanetti, Carl Lanore, Superhuman Television.
Superhuman Television will return after these messages.
Your body knows what it wants. It wants to feel stronger, work harder, act faster, and think sharper. Give your body more nutrients, more antioxidants, more protection, more of what it wants. Try Live On Lab's liposomal vitamin C today, risk-free, and give your body the nutrients to support your overall health, without jitters, without side effects. Order online at liveonlabs.com.
Welcome back, folks, to Superhuman Television. I am Tony Vanetti, Carl Lanore. We're talking about type 2 diabetes, not type 1, but type 2 diabetes today, which means preventable. We're going to try to change some diet up, consult your doctor about what medications you're taking, and that's where we're going to next, correct?
Well, and so here's something I get all the time when people say, well, I can do this 80% of the time, but my wife loves to go out to the spaghetti factory and have pasta.
We live difficult lives. I mean,
I don't want to miss out on the pasta. Isn't there anything I can do? Yes, there is. First of all, if you take a tablespoon or two of vinegar, any kind of vinegar, acetic acid, about 10 to 15 minutes before a high carbohydrate meal, it will reduce the glycemic index of the carbohydrates. Remember, you've heard of glycemic index, right?
Yes.
The GI, the glycemic index, is how fast a carbohydrate gets into the blood and turns into sugar.
Okay.
So white bread and pasta, they're like 100. They get right into the blood and into the sugar, right? Okay. If you have just a tablespoon or two of vinegar before that meal, it'll bring it down to like a 50 or a 40.
Is there anything that tastes better than vinegar?
Well, cinnamon is another one.
Okay, all right,
okay?
Well, perfect.
But I'm
going to vote for cinnamon.
And this is why it's so great to put
vinegar.
Cinnamon on your oatmeal in the morning. If you want to have oatmeal one morning, you say, I have to have oatmeal in the morning, then put plenty of cinnamon on it.
Great.
Cinnamon will also blunt the release of sugar into the bloodstream.
Okay.
There are some supplements out there too. Berberine is a very, very effective supplement that will reduce blood sugar.
What is that? I've never heard of
It's
that
an
before.
herb, and you take it about 15 to 20 minutes before a meal, just like that.
All right.
And R-alpha-lipoic acid, we've heard of alpha-lipoic acid, but the R version of it was studied by BASF, and they wanted to turn it into a diabetes drug, but because it's naturally occurring in nature, they couldn't get a patent on it. So they abandoned all their research. But the truth is still there. R-alpha-lipoic acid is as effective as glucophage or metformin or any of those drugs out there.
Okay. Now, you said oatmeal. I'm thinking that oatmeal is probably a lot of carbs, right?
Yes, it is. But sometimes people feel like, well, if I just have some carbs, when can I have them? You can have some amount of starchy carbs first thing in the morning if you want. But this is after you've controlled your blood sugar for a while. You have to have your blood sugar down below 80 for a good 5 or 6 months so that a lot of the metabolic damage starts to become reversed. If you know when people get those liver spots?
Yes.
If you have liver spots, do you know what those are? Those are advanced glycation end products, a result of all the excess sugar in your blood.
Right.
It causes it actually causes the pigment in the skin to come together. It's called an AGE.
And I think you'd be shocked if you looked at the labels of what you eat and find out how much sugar, and even things that are under the guise that they are healthy for you, right? Like even the vegetables, like the V8s and all that, the sugary tasting V8s.
Yeah.
Turn it over.
Look at the sugar.
You think, I'm getting my vegetables in 1 glass of water or 1 glass of drink here. Look how many scoops of sugar in there. It's shocking.
Every 4 grams of sugar is a teaspoon of sugar. So if something has 12 grams of sugar, it's just like taking 3 teaspoons and just dumping it in your mouth.
Oh, my Lord.
One other thing I want to mention. There is a prescription aid called Cycloset. And it's a fast-releasing bromocriptine your doctor can prescribe for you. It's unlike any other drug out there when dealing with type 2 diabetes because it's the only one that can actually reverse it. Okay. You take it first thing in the morning upon waking up, and it causes a shift in the biological clock we talked about on the sleep show that you lack from not getting good sleep. So if you're a person who's diabetic, type 2 diabetic, and you get poor sleep, Cycloset may be the thing you need to talk to your doctor about.
Fantastic.
You take it first thing in the morning, and bang, it resets your clock, and it causes insulin to change.
But type 2 diabetes, as we review what we've done on the show today, is reversible. You can get back in
99% of the cases.
And if you're sitting there now and you have children or there's people in your life that you think maybe can walk down that path, I think you should you should consult your doctor to get ahead of it before it takes charge. And we're in the state of Kentucky. I guarantee you that the obviously healthy lifestyles here in Louisville and in Kentucky, boy.
You just made a great point. Go to your doctor and say, I want to get off of my diabetes drugs. I want to reverse my diabetes. If your doctor can't help you, then look for a different doctor. If you want to, if we've opened up some ideas for you, and you think, well, these guys didn't give me all the information. There's got to be more information out there. Then seek that information and work with your doctor. But make sure your doctor understands your goal. Your goal is not to live with diabetes and mask the symptoms with the drug. Your goal is to reverse your type 2 diabetes because you will live longer as a result of that.
Absolutely. And again, it's on you. It says how important it is to you, what you want to put in here. And we're going to hear that a lot from Superhuman Television. Carl and I, we're going to continue to tell you what you put in here because he hates the fact that I have a Diet Coke
the devil.
The table.
Aspartame, it's the devil.
It's the devil. I kind of love I got to have a few things. But what you put here is how important it is and how you feel and how you live and how you sleep and how you just go through your normal day. Okay, so that's what we're going to do here, and it's been a great show about type 2 diabetes. Again, we'll come back and wrap the show, but preventative, work with the medications, work with your doctor, and watch what you eat, and I'm going to go out and buy one of those blood sugar
You should.
Tools. How much does that cost?
They're like $25 at Walgreens.
All right, back after this. Superhuman Television.
Superhuman Television will return after these messages.
Your body knows what it wants. It wants to feel stronger, work harder, act faster, and think sharper. Give your body more nutrients, more antioxidants, more protection, more of what it wants. Try Live On Lab's liposomal vitamin C today, risk-free, and give your body the nutrients to support your overall health, without jitters, without side effects. Order online at liveonlabs.com.
It's the
Superhuman Television with Tony Vanetti and Carl Lanore. We're wrapping up our discussion with type 2 diabetes. Real quick, alcohol.
Raises
Drinking
blood
alcohol.
sugar. Raises blood sugar. Raises blood sugar.
So
you
watch
ask,
the
you ask any
alcohol
type 2
intake.
diabetic that the morning after they drink, their blood sugar is higher.
Right,
There's no
they
doubt
feel
about
terrible.
it. So, and in summary, you would not have the diseases that we have today if it wasn't for elevated blood sugar, hyperglycemia. Getting your blood sugar in check now will ensure that you don't develop these types of diseases. And even if you're on insulin already and you have type 2 diabetes, you can get off the insulin. I had a guy email me through the radio show, and he said, my doctor's making me take this much insulin for 180 grams of carbohydrates a day. I said, well, go down to 90 grams and have him cut the insulin in half, and he did it. And then they went down again, and they went down again, and 6 months later, he was off the insulin.
Wow, that's awesome story.
The thing to remember is this. If you don't eat the starchy and sugary carbs, your blood sugar will not go up. You'll manage it. You don't have type 2 diabetes anymore. After living that way for a year or two, you can start eating those carbs again in moderation.
Again, just watch what you eat, consult your doctor, and move forward. Again, healthy living, healthy lifestyle, sleep, and all that. That's what we're going to be talking about on this show. But it can, most importantly, you can go to your doctor, consult it. We eventually want you to get off all those drugs and just control this thing by your diet is the most important part. Again, look at the labels to see how much sugar is in everything you're consuming, including the banana. The banana's okay for me to eat? Tell me it's okay.
For you it is, because
for me it's a good snack.
Yeah.
Okay.
But not for somebody who's got type 2 diabetes.
Okay. All right. So no bananas on that one. All right. Thanks for joining us today. Superhuman Television.
Your body knows what it wants. It wants to feel stronger, work harder, act faster, and think sharper. Give your body more nutrients, more antioxidants, more protection, more of what it wants. Try Live On Lab's liposomal vitamin C today, risk-free, and give your body the nutrients to support your overall health, without jitters, without side effects. Order online at liveonlabs.com.